Good day, students, and welcome to our Health 9 class. Today, we are going to talk about community health. These are the objectives that we are going to achieve for today's lesson. First, define health, community health, and environmental health. We also have to explain how a healthy environment positively impacts the health of people and communities. And lastly, enumerate the different health programs in the Philippines. Take a look at this picture. What can you see? You are right. All we can see are houses, cars, plants and trees, establishments, and a happy movement of people. We can see this community is a happy and a healthy community. Let's now define health and community. Health is defined by World Health Organization as a state of complete physical, mental, and social well-being and not just the absence of disease or infirmity. It leads to a socially and economically productive life. To be healthy, we need to have happiness. Let's aim for a positive attitude always. We also have to have sleep. We must get 7 to 8 hours of sleep daily. And third is water. We need to drink plenty of water. We also have to have good diet. The right balance of carbs, proteins, fats, vitamins, and minerals. And of course, we also have to have exercise. Let's do exercise like walking, gardening, using the stairs, and moving around. Let's now define community. Community is defined as a sociological group in a large place sharing one environment. It therefore includes the individual and the family. Actually, it is a social unit with commonality such as norms, religions, values, customs, or identity. In this part, let's differentiate community health and environmental health. Community health is defined as the art and science of maintaining, protecting, and improving the health of all the members of the community through organized and sustained community efforts. In a community, the people should collaborate with one another to make organizations so that residents can focus on programs that can improve their health. For example, the organizations can give educational and community-based programs to encourage and enhance the health of the people, such as chronic diseases, mental illness and behavioral illness, oral health, nutrition, unintended pregnancy, and etc. While environmental health compromises those aspects of human health that are determined by physical, chemical, biological, and social and psychological factors in the surrounding environment. This focuses on the relationship between people and their environment, and this promotes human health and well-being and fosters healthy and safe communities. We have a lot of environmental health programs in the Philippines. Department of Health or DOH focuses on climate change and cholera, climate change and dengue, climate change and malaria, climate change and typhoid fever, water sanitation, your health during summertime, your health during haze, your health during typhoons, your health during El Nino phenomenon, your health during La Nina phenomenon, and your health during the holiday season. What are the characteristics of a healthy community? Do you have an idea? Actually, we have the 10 characteristics of a healthy community. First, a clean and safe physical environment. Second, an environment that meets everyone's basic needs. Third, an environment that promotes social harmony and actively involves everyone. Fourth, an understanding of local health and environmental issues. Fifth, a community that participates in identifying local solutions to local problems. Sixth, a community whose members have access to varied experiences, means of interaction, and communication. Seventh, accessible and appropriate health services and facilities. Eighth, the promotion and celebration of historical and cultural heritage. Ninth, a diverse and innovative economy. And tenth, a sustainable use of available resources for all. In the Philippines, there are a lot of primary healthcare programs that we can find in our community. Actually, when you were young or when you were in elementary school, I am sure that you have experienced some primary healthcare programs that your school offered. These are the health center services in our community and their functions. For the maternal health care, their focus is on the prenatal, natal, and postnatal of the mothers. Second, child health care. Their function is on immunization and control of diarrheal diseases. Third, nutrition program. Their function is on Operation Timbang and food supplementation. Fourth, population and family planning program. They give free family planning for the parents. Fifth, control of communicable diseases. Their function is to have a program that controls the spread of tuberculosis in the community. Sixth, environmental sanitation program. Their function is to inspect the food in the establishments in our community. Seventh, control of non-communicable diseases. Their function is to screen or to monitor the blood pressure of the people in our community. Eighth, dental health program. Their function is to extract tooth and take care of the dental health of our community. Reproductive health care is the ninth health center service. Their function is to counsel on family planning and reproductive health. 10th, medical morbidity clinic. Their function is to provide free medicines in our community. 11th, we have the National Voluntary Blood Services. Their function is to have bloodletting activities at barangay level. 12. Epidemiology and Surveillance Program. Their function is to control outbreaks like dengue in our community. 13. Disaster Management Preparedness Program. Their function is to give medical services and assistance during disaster. 14th, Mental Hygiene. Their function is to counsel adolescents. 15th, Pharmacy Services. Their function is to distribute medicines to all health centers in our community. Observe your community if the following characteristics of a healthy community are being observed and if your officials give the primary health care programs. Thank you for listening.